Okay, I have the impression from some of the literature that I've seen coming from your group that people travel big distances to have you work on them.
Yeah,
Um, and that is true?
yeah, that's correct.
And why is that, do you think?
Well, specifically with migraine, I mean, like I said, we're some of the only people in the world that are doing this. I have a couple other colleagues that are doing very similar stuff, and the ones that are really getting into it, that's why we're kind of teaching the program. But like I said, it doesn't matter where you are in the world; it's the exact same progression, and nobody's really looking at it from this altered resting membrane potential, genetically predisposed lens. And so what ends up happening is if you're a chiropractor, you're going to adjust that patient. If you're an acupuncturist, you're going to do acupuncture. If you're a medical doctor, you're going to give them medicine, et cetera, et cetera. Everybody's looking at migraine for the thing that they offer. Nobody's looking at migraine for what migraine actually is. And so when we treat migraine patients, say from out of town, I want to do things that help to prepare their internal environment or help reduce as many stressors as I can. So before they come out to see us, we'll do nutrition for a month or so, specifically for migraine. We'll do hormonal testing to make sure that we've got all those levels at least starting to even out before we come out for treatment. Because if somebody's coming to me from out of town, I don't want to see them for months here because that doesn't make any sense. I want to see them for about a week or so, right? And we see them 3, 4, sometimes 5 times a day just doing these neurological exercises. And so if they, are detoxing off of caffeine or, are trying to get off wheat, and we're also doing these activities, they feel awful. And I've had a couple like that, and they do not like me that whole week. And so if we do the pre and do the nutrition hormones, then when they come out to see us, we can make a lot of progress in that week and then send them home with things that they can continue to do at home, like I said, to bring that resting membrane potential further down from threshold, and in my opinion, bring them down that migraine scale so that they're having less and less and less over time. It's like an exercise for your brain.
I assume you must have some miracle stories of people who were in extreme circumstances and it was transformative for them. Is there a case like that that comes to mind that you could
We have a
reveal?
couple. Yeah. Well, I mean, we had one last week that was really cool. She came down from Canada, and she had migraines forever. And about 2 years ago, her worst one lasted for 19 months, constant. And so when she came to see us last week, she was on the tail end. Well, ended up being tail end, but she had 100 and some day migraine. And so by the third day, end of the second day, we were able to stop her 107-day migraine, and it didn't come back the rest of the week, which was obviously great. And so she just, we got a message this morning that when she flew home, it was the first time she flew home without a migraine. She hasn't flown without a migraine in 25 years. And that was the first time that had happened, that was a recent one. But I had one lady come down from Northern California. This one was pretty cool. She had a 2.5-year migraine that had not gone away. Wow. And by the second day of care, it was gone and didn't come back. And she's been fine ever since. And the thing with her is she had a lot more neurological dysfunction. So when I see a migraine patient and their neuro exam is pretty good, I know there's probably more hormonal or nutritional or other things, psychological stuff going on. Whereas when I have somebody come in and, their balance is terrible and they can't follow targets, and, if targets come close to them, they get kind of freaked out. I know we're going to make some good progress really fast because their brain's just constantly overwhelmed. And when you calm that down and you make them balance and you fix some of these basic mechanisms, they do really good, really fast. And those are the fun cases. But, some are like